For the citizens of the USA, the healthcare system is one of the most controversial public services in the country, with many people unable to afford quality healthcare and hence being left in dire medical turmoil. The public healthcare system in the U.S. has been starved for resources for decades, often seeing both the patients and the staff suffering from either low pay and working extra long hours.
Very rough. We've been working 14, 16-hour days, caring for up to 90 patients on ventilators in our multiple ICUs. And we've been very, very, very overworked. However, it's been very gratifying to see the improvement in some patients and unfortunately the demise of other patients.
As if things weren't bad enough, the arrival of the COVID-19 virus has added an extra layer of pressure on the system, with the ability to treat the patients of the worst affected country becoming a real problem.
It appears to feel very similar to what first responders, particularly in the middle of 2014, experienced in West Africa in the Ebola epidemic, where there were too many patients. They didn't have enough beds, they didn't have enough capacity, and in West Africa, some patients were actually turned away from the entrance of the Ebola treatment units because they simply had run out of space. You know, patients died in front of these treatment units because there wasn't enough space. And a lot of patients died in New York because we didn't have enough space and we didn't have enough equipment.
Hello, welcome to Economic Divide with me, Kawitafwe. In this week's show, we will be looking at how the public health service in the U.S. is at breaking point and look into just how much is being spent on caring for the sick and needy people of America. Don't forget, we want to hear your thoughts on this or any other story. So make sure you get in touch with us via our Twitter page by using @ED_program. We look forward to seeing what you have to say. The arrival of the coronavirus has infected some 2.6 million people in the U.S., killing more than 126,000 people as of the recording of this show. Thousands of job cuts along the way, and it has cost the government $3 trillion. So how then can a public health service cope with such demand, with local health department ill-equipped to deal with a surging demand? On top of the demand for health services, the motivation and morale of the public health workers is at rock bottom, with many of them being paid so little that they too qualify for public aid as they battle outdated systems, work 7 days a week, rely on old technology, and use paper records often shared by fax. So why is this happening? Well, since the year 2010, taking a look at what's happening from that year on, what has happened is that spending for public health departments has dropped by 16% per capita, with spending for local health departments falling by 18%. Along with this, some 38,000 jobs have been lost, leaving a demotivated and, quite frankly, exhausted workforce.
The United States of America is going through one of the toughest tests in its history, as it deals with not only a major medical crisis, but also has to come to terms with the impact of the economy that goes with it. One of the main sectors that has seen a major blow both physically and financially is the medical care sector, which appears to be struggling to cope with the demand, seeing patients dying at an alarming rate in the US and the infection rate being the highest in the world. A major factor for the concerns, certainly within the public healthcare system, is the severe lack of equipment being provided to deal with the outbreak of the virus, which in some cases has led to protests demanding the government step up to the mark.
I think it's unconscionable that we put nurses on the front line of such a dangerous epidemic and not give them the proper equipment. It just can't, it boggles my mind.
The sheer scale of the shortages has also been raised by the doctors and healthcare professionals working in the sector, with many of them taking to venting their frustration at the lack of equipment on social media and video messages.
Hospitals are running out of medications. Some hospitals don't have protective gear for staff or family members of patients that come to the hospital. We're running out of medications, we're running out of equipment, and we're even running out of oxygen, which is something that patients that have COVID-19 need.
Unfortunately for many frontline workers in the public healthcare system in the US, the dedication to their work under such tough conditions has meant that in the line of duty, they've had to pay the ultimate price, as trying to help others with minimum equipment has led them to catch corona and sadly lose the battle.
These are our fallen heroes. There are other heroes. We don't want to see any more fall. This is what we needed. This is what we got. We don't want to see any more healthcare workers die for lack of PPE.
Some of the figures surrounding the spending on public health in the U.S. are truly alarming. For example, most states are spending about $100 per person on public health. In fact, more than 3/4 of Americans live in a state that spends less than $100 per person. Take Louisiana, for example. The spending per person on public health there is about $32, which is really no more than a steak dinner in comparison. Delaware fares better with $263 per person, but on average, states only spend around 1.5% of the budget on health. When one looks at the salary staff earn in the public health system, most state workers earn $35,000 per year or less, with this poor pay rate being one of the main reasons that nearly half of the workers in the system wanted to leave their jobs, many of whom felt this way before the outbreak of COVID-19.
It's no hidden truth that in the United States of America, the access to healthcare is much like a lottery. If you're lucky enough to work in a job that provides all the benefits of private insurance, then the chances are life wouldn't be too bad for those in such a position. However, we know that not all people in the US are in such privileged positions. With nearly 30 million people in the country without insurance, the inequality is clear for all to see, with most of those without insurance in the lower class brackets, and more worryingly, those from black and Hispanic backgrounds. The introduction of the Obamacare insurance scheme, which is the affectionate name of the Affordable Care Act, was meant to allow people equal access to healthcare, but it seems at the very moment that it was conceived, the Republican Party sought to bring the plan to an end.
We'd like to see the Senate move on something. We are proud of the bill that we passed. We passed a bill to repeal and replace Obamacare, to replace it with a better system. But as you well know, the legislative process, for it to work, House has to pass a bill. We've done that. The Senate's got to pass a bill for us to even move the process forward. That's the next step.
Current US President Donald Trump was quick to sign an executive order instructing administration officials to waive, defer and grant exceptions to implementing parts of the Affordable Care Act, with Congress at the time ready to repeal and replace the act. But for many people, the notion of having some kind of insurance was a blessing in disguise, with patients often left in thousands of dollars of debt without the act.
We're not poor. I mean, when we're forced to pay for it, it definitely puts us in that, below poverty level simply because we're trying to afford the medication.
But for many of those with insurance, they still had another hurdle to jump, namely finding a hospital or doctor that will accept the insurance plan that the patient had, which for some can mean the difference between finding a competent doctor or not.
The only way you're going to get decent doctors and make sure you're going to get a check that they take the insurance is if you go to the emergency room. So if you have Obamacare, I think that the emergency rooms are getting people that don't necessarily need to be there, but they know that at least they're going to take your insurance.
Joining me in the studio is Eleanor Goldfield. She is a creative activist, journalist, and filmmaker. Now, her work has appeared on Free Speech TV, where she is a producer and she hosts the weekly radical news show Act Out. Her printed work has appeared via Mint Press News, Roar, Popular Resistance, RT, and more. Eleanor, thanks for being with us today. It's great to have you with us.
Thanks so much for having me.
Well, first up, let me ask you how difficult it is for people to get quality health care in the U.S., particularly those living further down the social ladder who maybe just can't afford insurance or don't have a job.
Yeah, that's a great question, Kaveh. There are millions who are still uninsured, even despite the fact that we have the so-called Obamacare, the Affordable Care Act, which is neither affordable nor caring. Millions more are underinsured, which means that they don't have, even though they have some basic insurance, they don't have access to most medical procedures or medical supplies because they're underinsured. So really, insurance in the United States is not an insurance against most of the things that happen even before the pandemic hit. We've got reports of people leaving hospitals now, having been treated for coronavirus with $1 million hospital bills that they are expected to pay in the midst of a pandemic when our economy is doing worse than it was during the Great Depression.
Okay, so we're looking at a U.S. public healthcare system that maybe in some ways is falling apart, based on, at least on the research that we've done, in terms of the services given, the facilities that are available. Are there other departments that are also being shortchanged that you have any idea on?
Basically, you name it. Anything that is for the public health or for the public good, anything from education, to food programs, to welfare programs, anything that helps people has been shortchanged for the sake of building empire, both abroad and at home. Things like, right now there's a lot of talk around defunding the police. For instance, New York Police Department is the 5th largest army in the world. It has a larger budget than the entire military of North Korea. So these are the places that get funds. Anything that has to do with public good and public health gets shortchanged. Yeah,
it seems that way. I mean, I remember how the U.S. President Trump bragged about how he's increased what he calls defense spending. But, when you have these state institutions like you just mentioned, maybe in terms of security, if you want to call it that, is that where they're diverting their resources, like for it to go maybe for these endless wars that everybody knows the U.S. is involved in, like maybe the weapons production facilities, or forcing their foreign policy through their army, etc.?
Yeah, I mean, more than half of the discretionary spending in the United States goes to the military. And you're right, it's odd to call it the defense budget. It's an offense budget. No one's attacking the United States. What the United States is doing is trying to clasp onto hegemony worldwide through violence. And that's where the funds go. The Pentagon hasn't even asked for its budget to be increased, and yet it increases every time there's a budget hearing. And it's important to note that this is not just a Republican issue. The Democrats have voted in lockstep with the Republicans to increase the military budget. So this is really an American force from both parties.
Okay, and before we let you go, on a different note, I'd like for you to promote, if you can, the recent documentary that you completed. I've only unfortunately just seen the trailer, but perhaps you can fill us in and the viewers and tell us what you did, which based on some of the reviews that I read, it was a great thing that you did.
Yeah, thank you. The documentary is called Hard Road of Hope, and something that might be interesting to your viewers, just a little teaser here, is that it's about West Virginia. And since the advent of coal mining in West Virginia, some $5 trillion have been mined from the hills of West Virginia. And West Virginia is also the 3rd poorest state in the nation. And, that disparity is also a very U.S. story. And so the documentary covers this. It also covers the resistance of the people there, the radical resistance that people have been doing for more than 100 years there. So folks can check that out at hardroadofhope.com, and you can also find more about my work at artkillingapathy.com.
Thank you so much. It's a pleasure talking to you, and it's great to see you again. Eleanor Goldfield there from Washington, D.C. Now, if you want to know more about Eleanor or follow her social media, her page details are on your screens now. Don't forget to check her out. Okay, we're about to take a quick break here on Economic Divide, but don't go anywhere as we have plenty more coming up. We're joined by our journalist and researcher, Atifah Patidar, as she takes us through her findings. Also, we will take a look at how the U.S. healthcare system compares to another struggling service in the UK, namely the NHS. We'll also take a look at the overall U.S. infrastructure and ascertain why so many departments in the U.S. are falling, or I should say failing, the people that they are meant to serve. So sit tight. We'll be right back after this short message. A deeper look at just why the U.S. health insurance system is something that fails both the patients and the doctors. A documentary about Vice News reporter Michael Moynihan showed just how difficult things are as he visited a host of specialist doctors in the U.S., in which they explained the bureaucracy and the red tape involved with U.S. healthcare. Our starting point, Ireland, where tech company Apple has overturned a €13 billion tax bill after winning an appeal at the European Union's second highest court. Next up, the head of the IMF, Kristalina Georgieva, has warned that the global economy faces continued challenges, including the possibility of a second wave of COVID-19, and governments should keep their support programs in place. The Federal Bureau of Investigation is to examine claims that Twitter accounts of leading global businesses and celebrities has been hacked. In posts appearing on multiple Twitter accounts, including those of Bill Gates, Barack Obama, and Elon Musk, the tweets claimed that by paying a certain amount of Bitcoin into a purse would receive a double back return. Could cryptocurrency hence be a future crime currency? And last up, a topic for a future show here on Economic Divide. The Lancet has stated that the world population is likely to shrink after mid-century, forecasting major shifts in global population and economic power. It's projected by the year 2100, fertility rates in 183 of 195 countries will not be high enough to maintain current populations without liberal immigration policy. For one doctor, a general physician, the act of carrying out a single checkup on a patient with health insurance is simply an act of losing around $200 each time, as insurance companies fail to pay out fair prices to U.S. doctors.
Much like the United States public healthcare system, the UK also has its own version, namely the National Health Service, or more affectionately known as the NHS. Founded on the 5th of July 1948, the NHS was initially the jewel in the crown of the British post-war establishment, and for many years operated as an efficient and effective service to the people of Britain. However, a lot has changed in the 75 years of its service, with the system essentially collapsing at an alarming rate, as exhausted, underfunded and under-resourced hospitals around the UK crumble apart and struggle to cope with the demand. The current Chancellor, Rishi Sunak, has promised to pump billions into the service, but could it be too little, too late?
Whatever extra resources our NHS needs to cope with coronavirus, it will get. So whether it's research for a vaccine, recruiting thousands of returning staff, or supporting our brilliant doctors and nurses, whether it's millions of pounds or billions of pounds, whatever it needs, whatever it costs, we stand behind our NHS.
But the problem stems from far deeper than the coffers of the NHS. It's the staff themselves, who, much like their transatlantic peers, are the ones that are facing demoralising working conditions on the front line in one of the worst pandemics in history.
I think the main thing I'm seeing with my patients is just that complete inability to access services, and what they're being offered is not enough. It's getting harder and harder for me to pass on, particularly in the mental health field, to pass people on to the care that they need. It's taking longer, the waiting lists are getting longer, the pressure on staff is increasing.
Add on top of this number of nurses who are resigning, the lack of budget and the extra demands being placed on frontline staff, and it's easy to see why even the youngest and most resilient doctors have had enough.
It's an untested, unthought-through manifesto pledge that means that this existing workforce is going to be spread really thinly across a week, working unsafe hours, working up to 100 hours a week, leaving to a zombie doctor workforce on the shop floor, which is going to provide unsafe healthcare for its patients.
On a political scale, the NHS has also come under the spotlight, as just prior to the COVID-19 crisis, the NHS had been offered on a plate to the US in return for a trade deal following the removal of the UK from the EU, something that should have left Boris Johnson as enemy number one of the service. But in a strange turn of events, namely Johnson catching the COVID-19 virus, the service that he had offered to sell out saved his life.
Joining me in the studio now is researcher and journalist Atifa Padidar, who has gotten some more information for us on this, of course, her take. Well, before you begin, to me it was amazing the type of infrastructure that the healthcare system, including the hospitals, have in the U.S. and how dilapidated actually the whole thing was. Even for Americans, that was a big surprise.
Yes, Gary, since we already talked about the U.S. broken healthcare system in this program, I thought I can talk about its effect on the upcoming presidential election. Public health care has been always a leading issue in the presidential campaign before this pandemic. But since the outbreak of COVID-19, things have become more serious for both Democrats and Republicans. The coronavirus pandemic has crippled America, and people are seeing how hospitals and medical centers are struggling. Obviously, voters want to see someone in the office who can get the American healthcare system out of this mess. Voters are also concerned about healthcare costs and the threats of losing healthcare coverage. So, it's safe to say that this pandemic and the current healthcare crisis are going to become the most talked about topics in the future presidential debate. Voters will be waiting to see who has a better plan. So far, Trump is in a bad position. His way of handling the pandemic and not helping the public healthcare has made him an undesirable candidate. His rival Joe Biden is no better shape. As a vice president to former US President Barack Obama, he didn't do much about the shortcomings of the public health care either. A lot of analysts believe that, regardless of what candidates might promise in their campaigns, there's not going to be much improvement. They say fundamental changes need to be made in order to have a better healthcare system. That's something Trump has shown that he's not willing to do, and it's not clear if Biden is the right man to do it either.
Very well. Thank you so much for that. We appreciate it. Obviously, that's going to be a factor in the upcoming presidential election. Now let's take a look across the Atlantic at the UK's NHS, something that, much like the US public healthcare system, is very much on its knees.
It's not just the public health service in the US that's under extreme pressure. A report by the American Society of Civil Engineers placed the majority of the US infrastructure under deep scrutiny by grading the most basic common services with an average of D+. One of the most basic needs for all humans is access to clean and potable drinking water. The US has failed miserably in this sense, with the engineers' report stating that the water supply infrastructure is not to standard, with some 240,000 water pipe breaks each year. The leaks equate to a loss of some 18% of treated water, which when combined could support the needs of more than 15 million households. It's estimated that in order to fix the problem, the cost would be in excess of $1 trillion and could take up to 200 years to complete the work nationwide. Water pollution is also a major factor in the US, with the case of the town of Flint being the most prominent. The case saw some 100,000 people infected with dangerously high levels of heavy metals. The added factor was that it wasn't taken seriously, as it was in an underprivileged black neighborhood, which, like so many others, was at the bottom of the list when it came to government priorities.
About 40% of the residents here in Flint are in poverty. You have poor black workers who are now suffering from a man-made crisis with lead in their water. There are babies that are sick that will have to deal with illnesses for the rest of their life. Grandmothers, you have people that are in hospitals for multiple months, and some people are losing their lives while politicians are sitting back playing politics.
Another major issue is the road infrastructure, which, like water, also scored a lowly D grade. In fact, some 32% of urban roads are in poor condition, needing some $836 billion to repair the backlog of repair demands on the roads and bridges of America. Finally, the US education system is also in dire straits, as over a third of public school facilities were considered as pitiable by the engineers. The reason for this appears to be the notion that school funding varies widely from state to state, and the federal government contributes little to no funding for the nation's schools. Teachers are also suffering from poor working conditions and lack of pay, hence leading them to become demotivated and hence becoming a weak link in the system.
The state constitution says they are to publicly fund appropriate education, and for the last 10 years they've cut 28% of that funding. There's not enough money to do the job correctly.
It's saddening to see that the world's largest economy is putting so little into the healthcare of the people who are essentially the backbone of the nation, from the workers to healthcare professionals, from the doctors to the nurses. They're all being abandoned by a failing infrastructure. But with jobs being lost, insurance becoming ever more expensive, and local services all becoming obsolete, what then is left for the working class in America, who rely on state services, at least many of them, to make ends meet? The economic divide in the U.S. is becoming greater than ever. When something like healthcare gets hit, even the needy and vulnerable are left to fend for themselves. Will the next government change the failed system? Well, a lot remains to be seen. Remember, we want to hear your thoughts on this or any other topic you'd like to share with us. So check out our Twitter page @SignED_program to share your stories with us. You can also catch this show again or any other past episode by logging on to our website, where all of our programs are online and on demand. That's about all for this week. I've been Kaveh Taghweh on behalf of the whole team here on Economic Divide. Thanks for watching. We'll catch you again next time.